With the kind of epidemiological curve that we are seeing right now in terms of the number of cases, given the caveat that we have no idea how many cases we've got because of the testing, but with the increase that we're seeing nonetheless, if we are heading toward very large numbers of Americans being infected with this virus, and as Dr. Fauci has said publicly, we're looking at a 15 to 20% serious illness rate among those who get infected. Should we expect that American hospitals are going to get crushed by a flood of very sick people?
Well, Rachel, we should expect that. And frankly, not even if we get anywhere near the numbers you were talking about in the last segment. We only have 1 million hospital beds in this country. 700,000 of them are full with people who are sick right now.
How many hospital beds do we have?
1 million.
1 million.
1 million. Now, of course, people come in and out of them. So over a course of a year, we hospitalize about 35 million people in the country. But as you said in the last segment also, Rachel, people who are hospitalized with this, if you're serious enough to go to the hospital with this, you're going to be there for a while, right? This isn't a 2-day hospitalization thing. And the problem is this, if you get a crush of cases in a particular city, a city like New York, but they could be big cities. We're not just talking about small cities where capacity is limited. We have limited numbers of ventilators. We have 65,000 ventilators for the whole country. Almost all of them are at use right now, particularly during flu season. If this really kicks up and creates just even a small increase, we're going to see hospitals in this country in particular places overwhelmed. And scenes like we're seeing in Italy right now of people in the hallways, people just not being able to get care. You find in these epidemics around the world that almost as many people often die not from the epidemic, but from the inability to get health care for other things. People get a chest pain. They don't go to the hospital because the line is too long or because they're afraid of getting the virus when they go to the hospital. And coronary incidences go up. So this is going to have effects on our healthcare system that go beyond even the dramatic effects of the virus itself.
Is it predictable where that's going to happen? Or does the pandemic terminology not just mean that it's internationally everywhere, but we should expect it to be everywhere domestically as well?
I think we should expect it to probably be everywhere, but not at the same time.
Okay.
And I think that's, again, one of the problems with this testing thing. What you want is intelligence of where it is and where it's going. And if you don't have measures, if you look at a map right now, that Johns Hopkins website, the best map, you see that there are states with many cases and states with 0 cases. There aren't states with 0 cases. There are states with 0 tests.
Yeah.
And so we don't really know where it is.